Today, we explore a remarkable case in neurological medicine, the non-surgical management of painless cervical motor radiculopathy. This rare condition, accounting for just 8% of cervical radiculopathy cases, presents unique challenges for both diagnosis and treatment. While most patients experience pain and sensory changes, a small subset, like the patient in this report, develops severe motor weakness without pain. This video will walk you through the patient's journey, the clinical decisions made, and the implications for future care. Let's begin by understanding what makes this case so unique and why it challenges current treatment guidelines. Cervical radiculopathy is a neurological disorder caused by nerve root compromise in the neck, often due to degenerative changes, herniated discs, or foraminal stenosis. Most patients experience pain, numbness, or tingling, but a rare few develop motor weakness without discomfort. This painless variant can be easily overlooked, leading to delayed diagnosis and potentially permanent impairment. Recognizing the signs and understanding the underlying mechanisms are crucial for timely intervention. In this case, the absence of pain made the clinical picture especially challenging, highlighting the need for careful neurological assessment. The patient, a 67-year-old male farmer, presented with sudden, profound weakness in his right shoulder. Notably, he reported no pain, sensory disturbance, or paresthesia. His main complaint was the inability to lift his arm above shoulder level, which severely impacted his daily activities and farming work. The timing was particularly challenging, as it coincided with the peak farming season, threatening his livelihood. His medical history was otherwise unremarkable, with only hypertension managed by medication. The absence of trauma, infection, or systemic symptoms further complicated the diagnostic process. On neurological examination, the patient showed marked motor weakness in the right shoulder, graded as MRC3 for flexion and abduction, and MRC4 for extension. The range of motion was limited to just 60 degrees. Sensory examination was normal, and there were no deficits in the right elbow, wrist, or hand. These findings pointed to a localized motor deficit without sensory involvement, a hallmark of painless motor radiculopathy. Such a presentation is rare and often leads to diagnostic uncertainty, emphasizing the importance of thorough clinical evaluation. Radiographic evaluation included cervical spine X-rays and MRI. The X-rays revealed multilevel degenerative changes, such as reduced disc height and osteophyte formation. MRI showed bilateral foraminal stenosis, most pronounced at C5, C7, T1 on the right, and a central disc protrusion at C4-5. Importantly, there was no evidence of cord compression or abnormal signal in the spinal cord. These imaging results confirmed the diagnosis of multilevel cervical radiculopathy, providing a clear anatomical basis for the patient's motor symptoms. The absence of pain and sensory symptoms made the diagnosis particularly challenging. Without the typical warning signs, painless motor radiculopathy can be mistaken for other conditions or overlooked entirely. In this case, the patient's functional limitations and imaging findings were key to identifying the underlying problem. The clinical team decided that further laboratory workup was unnecessary, given the lack of infection or systemic inflammation, and the patient's gradual improvement with conservative management. The patient's occupation as a farmer played a significant role in treatment planning. During the busiest season, he could not afford the downtime or risks associated with surgery. His strong preference for non-surgical management reflected both personal and socioeconomic considerations. This highlights the importance of individualized care, where treatment decisions are tailored not only to clinical findings, but also to the patient's life circumstances and priorities. After a thorough discussion of risks and benefits, the clinical team and patient agreed on a non-surgical approach. Current guidelines often recommend early surgery for severe motor deficits, but the evidence for non-surgical management in painless cases is limited. The plan prioritized conservative management, including epidural steroid injections, physical therapy, and pharmacologic support. This approach aimed to restore function while minimizing disruption to the patient's daily life and work. Over 5 weeks, the patient received 4 epidural steroid injections under fluoroscopic guidance. 2 injections were delivered via the interlaminar approach at the C6-7 level, and 2 via the transforaminal approach targeting the right C6 nerve root. Each injection included dexamethasone palmitate, hyaluronidase, and lidocaine. This combination aimed to reduce inflammation, improve drug distribution, and relieve nerve root irritation. The use of both techniques ensured comprehensive delivery of medication to the affected areas. Interlaminar approach involves inserting the needle between the laminae of the vertebrae to access the epidural space, while the transforaminal approach targets the nerve root directly at the foramen. fluoroscopic imaging, guided precise needle placement, and ensured safe, effective delivery of medication. These techniques are commonly used in pain medicine to treat radiculopathy and other spinal conditions, offering targeted relief with minimal invasiveness. Hyaluronidase, an enzyme included in the injection, enhances tissue permeability and promotes more uniform distribution of medications. In pain medicine, it is sometimes used to improve drug delivery, reduce local fibrosis, and decrease adhesions around nerve roots. In this case, hyaluronidase may have contributed to the rapid and sustained neurological recovery by facilitating the dispersion of corticosteroids and reducing paraneural scarring. The patient's progress was closely monitored at regular intervals, 4 days, 2 weeks, 4 weeks, and 5 weeks. At each visit, motor strength, shoulder range of motion, and subjective improvement were assessed. Initially, there was no significant change after the first injection. However, following the first transforaminal injection, the patient reported about 50% improvement in strength and increased shoulder mobility. By week 4, range of motion had fully recovered, and motor function was nearly normal. To objectively document the patient's recovery, sequential clinic CCTV footage was compiled into a supplementary video. This video illustrated the progressive improvement in motor function and shoulder mobility at each weekly follow-up. Such visual evidence provides valuable support for the effectiveness of conservative management in cases like this, offering clinicians and patients alike a clear view of the recovery process. In addition to injections, the patient was prescribed pregabalin and began exercise therapy. Physical therapy played a crucial role in restoring strength and range of motion, while medication helped manage any residual symptoms. The combination of targeted injections, pharmacologic support, and rehabilitation formed a comprehensive, individualized treatment plan that addressed both the neurological and functional aspects of recovery. By the 5th week, the patient's motor strength had improved to MRC grade 5, with full restoration of shoulder function and range of motion. He experienced only mild fatigue during strenuous activity, with no adverse effects from the procedures. Most importantly, he was able to return to his daily activities and farming work without limitation, expressing high satisfaction with the non-surgical approach and gratitude for the individualized care. This case challenges the prevailing belief that early surgery is mandatory for severe motor deficits in cervical radiculopathy. It demonstrates that, with careful patient selection and close monitoring, conservative management, including epidural steroid injections and rehabilitation, can lead to rapid and complete recovery, even in cases with profound motor impairment and no pain. This finding has important implications for clinical practice and future research. Current guidelines from major neurosurgical and spine societies recommend early surgery for severe motor deficits based on concerns about irreversible loss of function. However, these recommendations are largely based on studies involving patients with significant pain or progressive neurological decline. There is a notable lack of evidence addressing the optimal management of painless, yet severe, motor radiculopathy. This case highlights the need for more research and flexible, individualized treatment strategies. Beyond epidural steroid injections, other non-surgical modalities have been explored for cervical radiculopathy. These include regenerative therapies like mesenchymal stem cell injections, platelet-rich plasma (PRP), ozone therapy, radiofrequency ablation, and cryotherapy. While some of these approaches show promise, their efficacy and safety require further validation through clinical trials. Regardless of the intervention, physical therapy remains a cornerstone of comprehensive care. This case underscores the value of individualized, patient-centered decision-making. Treatment choices should consider not only clinical and radiological findings, but also the patient's occupational and social circumstances. In this instance, the patient's role as a farmer during peak season made conservative management a socioeconomic necessity as well as a medical one. Such personalized care can lead to better outcomes and higher patient satisfaction. This case expands our understanding of cervical radiculopathy by showing that the absence of pain does not rule out significant neurological compromise. It also demonstrates that conservative therapy can be effective, even in severe cases. Careful clinical assessment, shared decision-making, and thorough radiological evaluation are key to successful outcomes. By documenting sequential improvements, this report provides objective evidence supporting non-surgical management. As a single-case observation, the findings cannot be generalized to all patients with painless motor radiculopathy. The lack of long-term follow-up also limits assessment of sustained outcomes or late relapse. Further research, including prospective studies comparing surgical and conservative approaches, as well as investigations into optimal injection techniques and rehabilitation protocols, is needed to better define the role of non-surgical management in this unique patient population. The study was approved by the relevant ethics committee, and written informed consent for publication was obtained from the patient. All personal identification information was de-identified to protect privacy. Ethical conduct and patient consent are essential in clinical research, ensuring that patient rights and confidentiality are maintained throughout the process. At the final follow-up, the patient expressed high satisfaction with the non-surgical treatment, complete recovery of shoulder function, and a successful return to daily activities and work. He was grateful for the individualized care and the opportunity to avoid surgery. Patient satisfaction is a key outcome in any treatment plan, reflecting both clinical success and the alignment of care with patient values. This case provides several important clinical takeaways. First, not all severe motor deficits require immediate surgery. Second, individualized, conservative management can be highly effective in selected patients. Third, careful monitoring and documentation of recovery are essential for guiding treatment and supporting future research. These lessons can inform clinical practice and improve outcomes for patients with similar presentations. Findings from this case broaden the clinical spectrum of cervical radiculopathy and suggest that conservative therapy may be a viable and effective alternative, even in severe cases. This has implications for guideline development, patient counseling, and healthcare resource allocation. It also highlights the need for ongoing research to refine treatment protocols and optimize patient outcomes. Let's recap the patient's recovery timeline. At the first visit, motor function was severely impaired. After the first injection, there was little change. By the second week, strength and mobility began to improve. By week 4, range of motion was fully restored, and by week 5, the patient had regained nearly normal strength. This rapid progression underscores the potential of non-surgical management in selected cases. Shared decision-making was central to this case. The patient's preferences, occupational needs, and clinical findings were all considered in developing the treatment plan. This collaborative approach ensured that care was aligned with the patient's goals and circumstances, leading to a successful outcome. Shared decision-making is increasingly recognized as a best practice in modern medicine. Looking ahead, more research is needed to compare surgical and non-surgical approaches in patients with painless motor radiculopathy. Studies should also explore optimal injection techniques, the role of adjunctive therapies like hyaluronidase, and long-term outcomes. As our understanding grows, treatment guidelines can be refined to better serve patients with this rare but challenging condition. In conclusion, this case demonstrates that non-surgical management, including epidural steroid injections and rehabilitation, can lead to full recovery in patients with severe, painless cervical motor radiculopathy. Individualized care, shared decision-making, and close monitoring are key to success. This case challenges conventional wisdom and opens the door to new possibilities in the treatment of complex neurological conditions. Special thanks to the clinic staff for their assistance in data collection and to the patient for consenting to share his story. The study was conducted ethically, with no commercial or financial conflicts of interest. The insights gained from this case contribute to a growing body of knowledge and may help guide future care for patients with similar conditions.